Welcome back to Life Unrehearsed. My name is Matt Delvecchio, specializing in life transitions, home care, and the senior living industry.
And I'm Corrie, a clinical social worker and author of Someone Died, Now What? Hey, Matt, I understand you're going to be a presenter at quite a prestigious event, worldwide, in fact. Can you tell us a little bit about that?
Yeah, very proud and humbled. This, in fact, on World Alzheimer's Day, which will be September 21st, I'm going to be a panelist and a presenter for a live virtual launch of the World Alzheimer's Report 2022. Just an amazing, extensive report, over 400 pages. In fact, some of the co-authors include Dr. Serge Gauthier, one of the, right here in Montreal, one of the world-renowned researchers in Alzheimer's, and Claire Webster, who we've had on the show quite a few times, and very proud of Claire and Dr. Gauthier and the McGill team. They were given this mandate and they rotated in different countries around the world. And this year, it's the McGill team. And so that's Wednesday, September 21st. You just have to look up World Alzheimer's Report 2022 if you're interested in registering for that.
Beautiful. Congratulations.
Oh, no, thank you. Yeah, very exciting. And as mentioned, World Alzheimer's Day is September 21st. In fact, the entire month of September is Alzheimer's Awareness Month. The Globe and Mail just published a report saying that nearly 1 million people in Canada are expected to have dementia by 2030. It's not long. That's an increase of more than 65% from just a couple years ago. 1.7 million Canadians will have dementia by 2050. So unless measures are taken to reduce the risks and delay the onset of the condition, what happens, Corrie, is the increase in caregiving hours. Inevitably, people start to caregiver. 1.4 billion caregiving hours, or the equivalent of 690,000 full-time jobs, will be required annually to support this increase. So to tell us more about what we can do to prevent dementia, we have Camille Isaacs on the line. Camille is the vice president of a wonderful organization called Hope for Dementia. And Hope for Dementia is a Montreal-based nonprofit organization that advocates for prevention to become a national healthcare priority by promoting prevention awareness and services that mitigate risks and programs to potentially decelerate and reverse symptoms. That's what I love about Hope for Dementia. It's not necessarily about the cure, but what can we do to delay things? So Camille, welcome to Life Unrehearsed.
You can hear me loud and clear?
We can hear you loud and clear.
We can hear you loud and clear.
Good.
Now, and the reason why Camille is asking this, and I do need to put some context into this, Camille is calling from Jamaica, and we do pre-interviews before, and we talked earlier in the week, and everything was all set to go from her in Montreal. She had to fly down to Jamaica where her ailing mother was, and unfortunately, Camille, I understand your mother passed away yesterday, so on behalf of us here at Life Unrehearsed and CJAD, we want to extend our sincere condolences to you and your family. It really is a tribute to your courage and fortitude. I called you or texted her just about 2 hours ago saying, are you sure you're okay to do this? And you said, absolutely, let's go.
Yes, and I really feel that I need to do this because my mother, who passed away yesterday, she was the caregiver for my father, who lived with dementia for about 10 years. And I think that they want me to continue to put this message and to speak about hope for dementia.
Well, thank you very much for doing this. This is obviously very heavy for you, and we want to thank you for really taking the time during some challenging times in your life. Camille, pre-pandemic, cases of dementia in Canada were expected to reach, as mentioned, about 1 million people by 2030. However, the pandemic obviously aggravated this forecast. Why is that?
Well, first of all, I would say that in the pandemic situation, there were many restrictions, and those restrictions have made us more vulnerable to the risks of dementia. So social isolation, the lack of physical and cognitively stimulating activities, those are risk factors for dementia. The other thing is, with the reduction of income and job losses, there are some people who did not have enough income to purchase food and proper nutrition. Of course, when you're isolated and at home and in a depressing situation, you get depressed, and you can also develop addictions like drink excessive alcohol and smoke. And because the hospitals were filled with people with COVID, routine medical checkups and contact with health professionals was restricted. Mm-hmm. So all of these factors are putting seniors, particularly persons over the age of 65, at risk of dementia. And these risks have been identified as potentially modifiable, but we have to be careful that we don't fall into a routine where we put ourselves at risk. We need to start moving forward with ways to mitigate the risks of dementia.
So I love what you're saying about mitigating the risks of dementia. And I understand there's a long laundry list of things that people can actually do. And I'm all about action. And there's in fact something like 12 modifiable risks factors that you can engage in. So I know we don't have enough time to get to all of them, but I'd like to talk about some of them. And let's start off in no particular order with something like, what would you say is one of the first things that comes to your mind when you think about what is something that is manageable and will help modify or mitigate a risk factor?
One thing is physical activity. We all can, unless you're paralyzed and you can't move, everybody can get up and walk. And a 20-minute walk every day, right, adds to your physical well-being. So that's one thing. Another thing is diet. We need to stop consuming foods that are excessive in sugar and cholesterol that lead to hypertension and diabetes, which are risk factors for dementia. And then, of course, there's the social isolation. I noticed that I went back to a group that had met during COVID, and there are several people who are no longer there and people who have simply dropped out. We have to continue maintaining our social interaction, and it's very important for seniors to learn digital skills and communication applications. And of course, there's the chronic disease management. If you have diabetes or Parkinson's disease, these are conditions that predispose people to dementia.
We're talking with Camille Isaacs. She's the Vice President of Hope for Dementia. And Hope for Dementia is all about prevention and delaying what today is an incurable disease. And this is why you bring up such very important information, Camille. And what's, I guess, encouraging is that these are modifiable risk factors that you're talking about. There are certain things that like genetics, for example, may be out of our control, but there's a lot of things that we can do. And from what I understand, up to 40% of cases of dementia could be delayed or prevented if we start making some of these lifestyle changes. And you've mentioned a few, physical activities, diet, and social isolation. I like about digital, getting learning, not be afraid of learning. And so we're going to continue along, Camille, with a couple more of these risk factors and what we can all do today to make some of these lifestyle changes. And then we want to talk a little bit more about the Hope for Dementia and the programs that you're offering. Such a great nonprofit called Hope for Dementia.
Welcome back to Life on Rehearse. I'm Corrie Sirota, along with Matt Del Vecchio, and we are here continuing our segment on helping moms and dads. We are talking with Camille Isaacs, Vice President at Hope for Dementia. And what we're going to do is we're going to continue this really interesting discussion about lifestyle changes, because these are lifestyle changes that can actually help delay or prevent dementia. So I understand one that we haven't discussed yet is learning something new.
Yes. I wanted to just say that if you were somebody who, for example, knitted all your life and you continue knitting, that's good. But if you learn a new skill, I saw some recent research that is saying that if a person is learning a new skill, it is cognitively demanding, and it therefore is forcing the brain to work in new ways and learn new things. That has some potential to delay cognitive impairment, and it supports the person's cognitive health. So One of the things that we do at Hope for Dementia is that we like to let people learn new applications on tablets, and that helps them not only to stay connected with their loved ones, but it also is a way of keeping them cognitively engaged.
You know, I love hearing that, and this is, again, modifiable risk factors, lifestyle changes that we could all implement. And Camille, we want to hear about Hope for Dementia. Just to rattle off a couple more real quick risk factors, the obvious ones like high blood pressure and smoking and high alcohol consumption, but time and time again is the one you've just talked about increasing cognitive engagement. So I'm glad you mentioned that, and learning new skills and keeping your brain sharp. Talk to people. You know, the isolation you were talking about, crosswords, card playing, whatever you need to do, increase that cognitive engagement. Camille, we want to talk about your wonderful organization, Hope for Dementia. You've got several programs that help address the prevention and delay of dementia. Can you briefly tell us about these programs?
Well, we have 3 flagship programs. One is Healthy Food, Healthy Brains, where we distribute baskets of brain healthy food along with educational material to vulnerable seniors and low-income families on the West Island of Montreal. We'd like to expand that program. The second program that we have is the Intergenerational Learning Program, where youth teach seniors how to use digital technology using tablets, and in turn, the seniors are teaching the young people things about life, things that they are of interest to the young people, like a new language or cooking, baking. So it's a two-way street. Okay? And then the third program we have is Just Connect and the tablet distribution. It encourages seniors and their loved ones and families to safely check up on each other on a regular basis. And we like to make people aware of any warning signs of any cognitive decline that they might be picking up when they're communicating and connecting with their seniors. And I know this is the moment, how to help mom and dad. These are areas in which I believe that children of senior who have senior parents can become more involved. Go for that walk even once a week with your parents, and have a conversation. Don't just speak on the phone. See them in person or have a video type application to see if you detect any changes. When they have an appointment to go to the doctor, ask the doctor to offer some kind of cognitive screening test to see if there's any deterioration in their cognition. These are things that adult children can do for their senior parents.
So these are really phenomenal programs and seem to be bang on point in terms of really having a direct impact on someone's cognitive health. Can I go back? I want to revisit the Healthy Food, Healthy Brain. Can you tell us what are some of the food? I need to know this. What are some of the foods that are in that package? Because I need to buy them.
Okay, so first of all, we know that hypertension and diabetes are 2 risk factors that can be managed. So you want to stay away from foods that are high in cholesterol and high in refined sugars. So you want to emphasize leafy green vegetables, berries, whole grains, fish, coal-free nuts, and lean meat, right? And we're not saying that you can't have a dessert once a week, but that should not be at the core of your diet. Yeah.
You're listening to Life Unrehearsed with Matt and Corrie, and we're talking about some lifestyle changes that can help delay or prevent dementia with Camille Isaacs from Hope for Dementia. Camille, you are now with Hope for Dementia. You have many, many years of experience of dealing with dementia and Alzheimer's, working in different organizations. And if for our listeners that are listening, there are different stages, right? You might be at the very beginning stage where you're starting to see some signs of yourself or your loved one, or you might be right in the fire, in the inferno, and it's very, very difficult. So What would you recommend to families? I know there's resources out there. We tend to find that you take this on your own, and you may even feel like you're on an island on your own. What would you recommend to families if you're starting to experience some signs of dementia or seeing that?
Okay, so the first thing is let's be very clear on what are the warning signs of dementia, and people need to get an informed opinion, and not only an informed opinion, but get the facts. And there's a lot of factual information that is available on Hope for Dementia's website, hopefordementia.org. There are all other organizations like Alzheimer's Disease International and Alzheimer's Society of Canada. All of these organizations have information that are factual about the warning signs of dementia. Get the facts first, speak with a family doctor, and insist on getting some form of screening. You can't get a diagnosis of dementia, from some of these screening tests. It takes a series of tests, but the first one would give some indication of whether the person is experiencing any kind of cognitive decline and warrants further testing.
For the general community, we were throwing around the words dementia and Alzheimer's. Can you make the distinction?
Okay, dementia is the umbrella term for changes in the brain that adversely affect a person's ability to carry out their daily tasks. Alzheimer's is one form of dementia, okay? And it's the most popular or more common form of dementia, right?
I'm glad you brought that up. And other forms, Lewy body, vascular, and so on. But
right.
Alzheimer's is one of the most popular ones. We're running out of time. However, we'd be remiss. You have a very important gala coming up. You do this every year, Camille, on November 5th. Can you tell us about it?
Okay, so on November 5th, Hope for Dementia is having its annual Impact Gala at the Salon de Cristal in Ville-Saint-Laurent. This is an event that brings together persons who are in business and also in the public and private sector, obviously. But we're building a community of persons who are advocating for dementia to be a national healthcare priority. We'll have a mix of entertainment and science at the event. There'll be Albert Nuremberg, who's a filmmaker and journalist, and of course dancing with DJ Mario. But we'll have also Dr. Martin Arguin, who is a full professor of psychology at the Université de Montreal. Dr. Patricia de Berg, she's a program director of Aging in Place Challenge program at the National Research Council. It's an opportunity for persons to network, to discuss, and to meet and understand the issues that are underlying the growth in the diagnosis and what they can do about it. Sorry, go ahead.
Sorry, just have to cut you off here. That's the Hope for Dementia Gala that you're talking about, and yes. We also want to let our listeners know, Camille, how could people find out about your organization, Hope for Dementia?
Very easily, hopefordementia.org, and once you go there, you will find all of the information I'm talking about our gala, about prevention, about our mission, about our programs, and also follow us on social media. The icons are there. hopefordementia.org.
All right. Well, thank you very much, Camille, and thank you for tuning into Life Unrehearsed. As a reminder, for all your inquiries or assistance with life transitions, elder care planning, and the senior living industry, it'd be my pleasure to help. Our services are completely free. Call me at Lianas Senior Transition Support, 514-622-8074, or look us up at Lianas Senior Transition Support. Many thanks to our technical producer, Dean. Great job. And you can listen to Life Unrehearsed here on CJAD 800 every Saturday at